Are you thinking about starting a GLP-1 medication or already on it? Well, if you have stopped and thought, how does this GLP-1 affect me, my life, beyond the scale? Then you are in the right class today because Dr. Thomas Levy, who is world-renowned cardiologist, world-renowned integrative expert, and orthomolecular scientist, he is here today to talk about some of the things that I never even thought of because ever since we started talking about GLP-1s and they came out in the pharmaceutical world, I was told about all the side effects, cancer, muscle loss. But Dr. Thomas Levy just wrote an article that is fascinating. And today we have the privilege and the honor to discuss it with him. So get your pencils, get your pens, get your papers, whatever the case might be, and however you take note, because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show, Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friends, will feel empowered to embrace a new truth and live the life of your dreams. Well, today we are looking at GLP-1s in a totally different way than I have been looking at it in the past. Why? Why? Because someone who I call a mentor, someone who I truly value his opinion, not just opinion, but his research, his profession. This is not like we're talking about Santa Claus here. So I am open to learn more. I just read his article and I thought it was fascinating. It takes a totally different approach. And I'm hoping that if whether you're on GLP-1s or contemplating it or decided that you're not going to do it, that you will hear something critical that will help you confirm the decision that you have made. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Thomas Levy is here to do just that. Hi, Dr. Levy. Thank you for being in the class today.
Hi, Lily. Happy to be here as always.
Well, okay. So when you were talking to me for the first time about GLP-1s, I said, first of all, what about the side effects? I've heard it gives cancer, muscle loss, nausea. It loses people become malnourished. And you said, yeah, but I'm doing it differently. I know this differently. And it's taken me a while. I wanted to do my own research. And now here you are. Not that I need to prove you wrong or anything to that effect. I am just excited to have this conversation so that others can benefit from it. Does that make sense?
Sure.
And I also, just to get started, I wanted to share your involvement with GLP-1s. Are you being paid by a pharmaceutical company?
I wish I was.
I love how you say that. Okay, and I truly believe that. So let's get started. Why did you dive into, because your focus is vitamin C. Why did you dive into GLP-1s and vitamin C? Why would you do this?
Well, actually, I haven't had an obesity problem, but I've had a belly problem for some time. And I've had an increasingly bad back, and I know that's more weight on my back. And I didn't like my appearance. I didn't like the more back pain, etc. And at that time, I was aware of these drugs and really nothing more than what you were saying with all the side effects. And then you read on the daily guide or daily star and everything, all these different side effects and pancreatitis and eye problems and cancer, etc. And I had stayed away from them. And then as I now live in Colombia, South America, I found out that there was an oral form of the drug, very low dose, basically the same drug as Ozempic, semaglutide, but in an oral form, very low dose, and quite inexpensive. I mean, at the time, it would have been $1,000 in the States, and a month's worth was about $150 here in Colombia. So I decided to start it. And very interestingly, I started losing a little weight. But then, and you've known me a fairly long time, Lily, and been around me probably enough in recent years to notice that I always cough. I always cough. I always cough. Okay. I've had that problem literally all my life, sometimes worse, sometimes better. I've done a lot of things in the past that increased my vitamin C status that I've talked about in my book, and I get better, but I still couldn't shake it. It's literally been with me all my life. And suddenly, after taking this for 2 weeks, I started thinking, I said, my God, you haven't coughed for a week. Whatever's going on with this drug has taken away a symptom you've had your entire life. And I also noticed increased energy and a few other things. But that was so profoundly important to me because, like I said, nobody can appreciate, probably think I'm exaggerating, that you had a symptom your whole life and you couldn't do anything to get rid of it. And now 2 weeks into taking this drug, along with all the other supplements that you take, of course. I mean, I'm a heavy supplementer, you know. All of a sudden, this was gone. And I said, wow, I think I need to do, as they say, a deep dive on GLP-1. And that generated the article that you wrote. But in a nutshell, and I'm going to talk about some of the total misconceptions about this, the title of the article, I don't have the precise title, was basically saying that GLP-1 receptor agonists, which is what we're talking about, and vitamin C together is the most incredible anti-aging and pro-health combination you can imagine. And I now realize, and we've talked about this before, that ultimately good health is the parameter that you need is how normal is your vitamin C level inside your cell. If you can get vitamin C levels normal inside your cell, you have a normal cell, you have a normal tissue, you have a normal organ, you have a normal body, you're in completely normal health. That's it. You can't have an abnormal cell and be sick if your vitamin C levels are normal inside your cells. That's beyond talking about that, but that's the premise. So as I went into my research, I realized a number of things. First of all, the basic, very basic functions of the GLP, not the drug, but of GLP, which is what this is imitating. The drug is imitating a hormone called GLP-1 inside your body. What that does is it stimulates the pancreas to keep your insulin levels a little higher. And it also inhibits a substance called glucagon from releasing glucose into your blood. So it simultaneously increases insulin while decreasing glucose levels in your blood. And why is that significant? Well, number one, it was initially given to treat diabetics, and it's a fantastic treatment for diabetics because those are important parameters that are deranged in a diabetic that this helps to control, it helps to correct. And in fact, my blood work, I'm not a diabetic, but my blood work with regard to glucose and all has improved phenomenally in that regard. Now, in the real important point here, though, is let's go back. You probably remember this from the physiology we talked about. Insulin approaches glucose and vitamin C in the blood in the same way. In other words, insulin can't tell the difference between glucose and vitamin C because they're very similar molecules. And what insulin does to bring glucose into the cell, insulin also does to bring vitamin C inside the cell. And it's direct competition. If you have a large amount of glucose, a small amount of C, mostly glucose goes in. Vice versa, if you have a lower glucose and a lot of vitamin C in the circulation, more vitamin C goes in. So it's important to remember this direct competition between glucose and vitamin C for the effect of insulin to come into the cell. Well, then that is your answer right there. And by that, I mean, when you take a GLP-1 drug And this keeps your insulin level a little higher and your glucose level a little lower. You're creating the perfect metabolic microenvironment for any vitamin C that you then take to be ushered inside the cell in large amounts. And
Oh,
so that is it in a nutshell. I
that
can
is
give
a
you some more
great,
details.
no, I love that. Let's start from there because I have questions. When you
Okay.
were talking about the similarities between insulin and glucose versus the insulin doesn't know the difference between glucose or vitamin C,
Right.
that sounded very similar to insulin potentiation therapy, which is a treatment for cancer. Is
Mm-hmm.
that the concept behind it, where when they use insulin potentiation therapy, which is a low dose of chemo, and if it's fed so that the cancer tries to gobble up.
It's actually an important parameter working in insulin potentiation therapy, but no, it's not realized.
Okay.
The
Okay.
people that use that therapy don't realize or have never written to my knowledge about the things that I'm talking about. So, but that's right. That's what occurs in insulin potentiation therapy as well.
Okay.
So
So
yes.
then the second question from what you were talking about a low dose GLP-1. And to me, a low dose of GLP-1 is called a peptide, right? It's just the peptide therapy. How were you doing peptide therapy or GLP-1? Because what I understand with
No,
GLP-1
this is
is that
this
it's a
is
macro
right.
dose versus a micro dose.
Dose, yes, the dose varies, but the drug itself is called semaglutide, which is the same drug as Ozempic.
Okay.
It's the same drug that you're getting injected, but you're injecting a larger dose. Okay, number one, and it's being injected. This number two is a very low dose, 3 milligrams, and it's taken orally. Okay, and so let me go on then about these effects. After I saw that and I
Yes.
started doing this research, then I was absolutely stunned to see that there was an enormous amount, and they're all cited in the article, an enormous amount of articles that showed, not with vitamin C, of course, that just people taking GLP-1 drugs has significantly decreased all-cause mortality. So these drugs were keeping people from dying from all conditions. And that also immediately raised a red flag. I said, well, why all conditions? Well, if this affects the ability of vitamin C to get inside all the cells, and without even taking extra vitamin C, you still have vitamin C in your circulation, in your tissues. And when you have something like this, more of the vitamin C can start going in. That increases the longevity of all the cells. So then we talk about the side effects, all right? Now, first of all, let me just say, in general, the group of people who are taking this for weight loss, many of them are very large, okay? They're very sick. They have diabetes. They have other conditions. They have high blood pressures. They're not well people. They're hoping to get well, but they're not well people. Well, that subset of patients is going to get cancer. It's going to get pancreatitis. They're going to get eye problems. And so it's beyond me how they can say when somebody's taking this drug and they get pancreatitis, that it's because of this drug. That's number one. I mean, this is already a subset of people who have a lot of illnesses and are going to be getting more illnesses and conditions in the future. Number two is it's important to understand the nature of fat. Okay. Why? This is going to sound like an oversimplification, but I guarantee it's not. The reason people get fat is because they have a large exposure to toxins, mostly fat soluble versus water soluble, large fat soluble toxins, and they don't have a good diet, or even if they do have a good diet, they're not supplementing. And we've talked before, supplementation with things like vitamin C is not an option if you're looking for optimal health, because we should be getting much larger amounts. So what's happening is large amount of toxins, people are being exposed to it. They're not taking in enough vitamin C to neutralize those toxins, which is the natural role of vitamin C. And so the body needs to initiate a compensatory mechanism. It always tries to protect itself. So if the body is incapable of neutralizing these toxins because there's no vitamin C to do it, what does it do? It triggers the formation of fat to put the toxins into storage so that they can't actively poison the individual if you want. And that's basically the primary reason why people get fat and get fatter and get fatter. However, and this is important too, and number one, they actually have studies, believe it or not, it's clearly statistically significant, not profoundly significant, but in obese people on no supplements at all, you start supplementing with vitamin C, they start losing weight. Okay, so you start neutralizing the toxins, they stop taking them up, and they're able to start mobilizing fat. Now, I just said fat is chock full of toxins. So what happens in this, and I'm going to tell you, I don't have a paper to show you this, but I'm willing to bet that most of the people that have the worst side effects are the very fat and the ones that are most impatient, understandably, to get the process going, to get the fat out, blah, 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 push the dose up. What happens when you break up the fat? You release those toxins back into the bloodstream. So you basically give yourself a low grade of chronic poisoning in the process of mobilizing your fat. Once again, you need the vitamin C and other quality antioxidants to deal with this as it comes out and mobilizes just as much as you needed to neutralize them and prevent the fat from developing in the first place. So
it makes sense.
That in a nutshell. So now there are some people, I read an article, looked at an article recently, was really trying to scare people. And if it's true, it's true. Okay. But sudden blindness and this, that, or the other. Well, I would say this, that if you have any concern about any sort of side effects and you're not supplementing at this time, okay, go through a stout regimen of when we talk about the Super 8, but especially vitamin C, magnesium, and vitamin D for sure, for at least several weeks before you start the drug. Okay, so you get those levels up. I mean, in a diabetic patient, I think you recall this, because of this competition between glucose and vitamin C is always losing, glucose is always winning, and all the cells are extremely scorbutic. You have a lot of cellular scurvy. So work to help reverse that for several weeks. And then, as I talk about in the paper, you got to be patient. You go with the lowest dose imaginable, all right, and proceed there. And that may or may not cause you to lose weight, but it will have this physiological effect that'll help bring vitamin C into your cells. So it might not have been their attempt, but they stumbled across some incredibly wonderful drugs here.
Yeah, and I get your enthusiasm. I mean, you've been talking to me about this now for a couple of months. And so here are some backup questions too, because you're talking about the oral versus the injection, low dose versus a high dose. And so when you take anything orally, it goes through your GI tract. It could cause some symptoms and everything with, especially in your stomach, digestive issues or whatever it is. How is it different? How is this low dose oral GLP-1 different than any medication that you have to take orally?
Well, probably the more common side effects are not directly related to intracellular scurvy and the vitamin C deficiency. There were indigestion, diarrhea, constipation. I mean, if you develop a problem like that and it won't go away, well, then the drug's not for you. Okay. And I can't give you a precise physiological reason why some person might tolerate it well and others might not. But there's also an adaptation period. Sometimes you start in for a few days, you're feeling a little uncomfortable, or you're not pooping as frequently or something's just, and then you adjust to it. And that's fine if you can adjust to it, because the benefits are marvelous. The benefits are marvelous. I mean, there's some other, prescription drugs we've talked about, the calcium channel blockers that increase longevity. There's not a lot of prescription drugs that I would just say are good for you. But this one, if you bear it in mind, is. Now, another thing too is you see a lot of information out there about such individuals they talk a lot about cortisol these days as being the bad guy. Oh, the cortisol levels are elevated and often associated with something like this. Well, guess what? And we've talked about this before. Cortisol, which is the hormone your adrenal glands make, is specifically designed to respond to toxins by pushing vitamin C inside the cell. That's what they do. Now, let's go back again. The patient that's on this drug, that's not taking vitamin C, has not that much, and for a long time, a body has another compensatory mechanism. If there's not enough vitamin C inside the cell, the adrenal gland starts making more and more cortisol chronically in a futile attempt to address that vitamin C deficiency in the cell, but there's no vitamin C to push in. So the cortisol goes up, but no vitamin C comes in. And so people start getting these chronic elevations of cortisol with all the side effects that go along there. One of which is to make more glucose, because high cortisol levels stimulate a process called gluconeogenesis, where, guess what? They use up protein from your muscles to make more glucose. And that's where the muscle wasting comes from. So if you have no reason to have excess cortisol be made because you're addressing the vitamin C and you're keeping the cells full of vitamin C, there is no significant gluconeogenesis and there is no muscle wasting with the drug.
Interesting. Okay, so when you're talking about cortisol, the option would be, is it hydrocortisone?
Hydrocortisone, right.
Okay, so you recommend a low dose hydrocortisone. Do you take that with vitamin C at the same time?
Yes.
And do you take that in the morning or do you take it in the evening? And by the way, Dr.
No.
Levy is not prescribing to any of us. We're just having a conversation. It's up to you to decide what you do for your own life. Go ahead, Dr. Levy.
Only in the morning. If you take cortisol or hydrocortisone in the evening, you'll stay up all at night. It really wires you.
Okay.
Now, if you're fighting an infection or a disease, I'll often, under those circumstances, take a second late morning or early afternoon dose with another large dose of C, and that generally will work very quickly to knock out whatever infection was smoldering or threatening.
What about IV vitamin C with hydrocortisone? Let's say you go once a week and you get 50 grams, for example.
Well, I mean, it depends on what the therapist has. If the therapist is a doctor and they can give you a little IV hydrocortisone with it, great. If not, you can take it orally. So that depends on what's available. Okay,
interesting. I'll ask Holly if she does that at the drip bar too, because I normally go to the drip bar, get my IVs. And so I was just wondering if that is something. So they can inject hydrocortisone.
They can inject it, or you can take the oral dose before you take off. And because your peak levels after an oral dose are about an hour after you take it. So take your oral dose and roughly try to time it to an hour when the IV is infusing.
Okay, I want to go back a little second because you said there are certain drugs that are good for you. Like you're talking about this GLP-1 oral dose as, you know, and GLP-1s altogether as reducing all-cause mortality. So you mentioned also calcium
channel blockers. Right.
Calcium channel, isn't that like Pepsid or Nexium?
It's the pharmacological versions of magnesium. Magnesium has all of its tremendous positive effects in the body by blocking calcium going into your cell, because you recall.
Oh, okay. So, but when you say calcium channel blockers, for some reason, I don't know, I got a little confused here, but I thought that was something that is like Pepsid or Nexium or anything like that.
No.
They had the wrong thing. Okay.
This is preventing calcium uptake inside every cell in your body.
Got it. Okay. Got it. Okay. So because we don't want calcium in our body. And so I just got a little
don't want an excess of it in your cells. And any cell that is diseased has excess calcium. Can't exist any other way. When magnesium blocks these calcium channels, the calcium levels come down and everything gets better, which is why magnesium makes everything get better. Perfect. But they have prescription drugs like verapamil, diltiazem, nifedipine, different classes, but they also work to block these calcium channels. And they have studies that show when you take a long-acting form of a calcium channel blocker prescription drug, it decreases all-cause mortality,
Wow.
which is not surprising when you consider the fact of what they're physiologically doing.
So as you were taking the GLP-1, you're also taking the Super 8 because magnesium is very important. So if you're taking bare minimum, vitamin C, you're doing the GLP-1, you're doing magnesium and possibly K2, right? Would that be a nice combination?
Sure. I mean,
Okay.
I often recommend for economic purposes, because everybody these days faces economic constraints, the three supplements that you absolutely have to have, and they're all quite inexpensive, are vitamin C, magnesium, and vitamin D. Nobody, in my opinion, is doing their health any favor if they're not at least supplementing those three things. The amounts, well, we talked about the amounts before. That depends a little bit on the person and the circumstances, but you should be synthesizing vitamin C, and most people aren't. All the toxins have knocked your magnesium levels way down. And I guess our indoor migration from the days that were primitive has just given us so much less sun exposure. We're really all vitamin D depleted, even in the sunny climates. Now, I don't talk about the lifeguard. I'm talking about the person that's in the sunny climate, but still stays inside their air-conditioned apartment all day.
Yeah, but we have to also remember, Dr. Levy, that some of these sunscreens cause cancer. And so we need to understand that the sun is not the enemy. It's really the stuff that we put on our skin. I don't know if you have any comment to say about that.
No, I'm just saying that it's a fool's errand for most people to think that getting out in the sun a little bit is going to completely take care of their vitamin C deficit.
Yeah.
I mean, now the lifeguard, yeah, he's got a good vitamin D level, but we're not talking about the lifeguards.
Okay, so you're talking about the GLP-1s. Are you saying the article was, or the research that you quoted, you were saying that everybody who's in GLP-1, it increases all-cause mortality.
Decreases,
Is that
right.
increases?
Decreases the
Decreases.
mortality.
That's what I said. Decrease. Okay, decreases all-cause mortality. Now, with that in mind, let's look at. I love how you said, most of these people that are morbidly obese are predisposed at this point to get cancer, heart attack, or whatever. So by adding this into their life, it's helping. But you're also talking about doing this responsibly, doing it with vitamin C, optimal nutrition. So how many people have been told you can take GLP-1s and just basically sit and eat whatever
I'm
you
sure most of
want?
them. That's why I'm introducing this information, because the doctors don't know this. The GLP-1 pharmaceutical companies don't know this, okay?
I know,
But
I know. Yes.
it's important that they do, because GLP-1 use is going to do nothing but increase, because even with these reports of side effects, you still have the incontrovertible data that as a group of people, they're living longer and they're living healthier. Okay, so yeah, I couldn't think of anything more horrible than losing vision in an eye or something like that, or getting pancreatic cancer. But I'm
But you
telling you, everything we do in medicine is statistically based. Ultimately, we can't guarantee that every person in a 5 million population is going to respond this, that way, or the other. So there's always exceptions to the rule. But I'm telling you, these physiological premises that I'm talking about are the reason why this happens. And they can
it's
be addressed. They can be addressed. And
yeah, but
yes, I wish.
they're not addressing them. They're not addressing them. There's a lot of people that end up with like extra skin on their body. They end up having malnutrition, their hair loss, getting cancer. But you're saying that cancer may not be attributed to the GLP-1, that it would be attributed to all the toxicity in the body stored with the fat that is now being released back into the bloodstream.
Relief chronically. I mean, you just chronically. I mean, we've talked about oxidation. Oxidation is disease. Toxins cause oxidation. Okay, so You're just releasing nonstop the essence of disease as your fat dissolves.
Okay, so I have a little machine I want to talk to you about afterwards in the air, off the air. I don't know why I didn't even mention it to you, but it's a machine that you put. Actually, it's not a machine. It's a suit. It's like a wetsuit, and it's in my website. It's a suit that has all these different muscle stimulation. It stimulates your muscles as you're working out, as you're walking, as you're resting, because some people just, their knees hurt, they can't rest. But what it does is that it stimulates their muscle growth again, and it's just been phenomenal. I'm looking forward to bringing this out so people can hear about this too.
The website is trumprx.gov.
Okay.
Okay. And all I can say is a physician friend of mine did it and used it, and it's up and running and working. And it apparently very user friendly. So you don't have to worry about getting bogged down if this is something that you want to try. And with my background, everything I know, everything I've professed, everything I've written, I recommend, unless you start taking it and you don't tolerate it because of GI side effects, it just doesn't agree with you. If you take it and it agrees with you, I recommend something like this, either a 3 milligram daily or a 3 milligram several times a week. You don't even have to take it daily. And the Super 8 supplementation, definitely for everybody.
That's amazing. That's amazing. So I'm going to switch gears here a second.
All right.
We're gonna go to, I want you to go to whenyouneedafriend.com. Make sure that when you go to whenyouneedafriend.com, you subscribe to the website if you haven't done so already. It's a two-step process. So make sure that you subscribe and go to your email and opt in. That way you'll have all the information that Dr. Levy, that if you want to get a hold of Dr. Levy, all the information is there. I want to encourage you to also like me on social media, like me on BitChute and YouTube, subscribe to these channels, share this video with your friends, let people know that we're all about choice, personal choice. So you can research all this information. Don't believe a word that we say. Just look at the article and check out half of the article that Dr. Levy has written is full of the people that in the articles that he researched, all the research that is out there is there for you to also do the research if you want to do it. And so I want to encourage you also to go to my Shop Now page. And when you go to my Shop Now page, I'm just going to highlight this one because for those of you who are concerned about muscle loss, there is a suit called Vision Body. And when you put this suit on, it will stimulate your muscles into regenerating. It's just an amazing suit. I've been using it now for over a month and I love it. So I want to encourage you to check that out. There's also other things that are Lilly approved products. I want to encourage you to go there. If you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, a one-time donation of your time, your talent, your treasure, please consider helping the classroom grow in any way that you can. Today we have Dr. Thomas Levy, who is looking pretty good, mighty fine, and a happy life that he is living in Colombia now. I miss him here in Florida, but he has started a journey, and I'm so grateful that he is in the classroom to share this journey with us. I still have a lot of questions for you, Dr. Levy, and
I'm ready.
now, in his latest book, it's called The Only Cause of Disease, The Only Cause of Disease. That's his latest book. Check out that book. Get it on his website. You can go to tomlevymd.com. You can get it there. And I just want to encourage you to do everything that you possibly can to live the life that you want. And without pointing fingers or feeling like a victim, do whatever you can. Now, Dr. Levy, you talked about 3 milligrams daily. You talked about 3 milligrams daily. And at 3 milligrams daily, you're saying you can do it every other day. You can do it once or twice a week. What are the contraindications? Who do you recommend? Let's say, for example, someone like me. I am within my weight range, or someone like, maybe they're like maybe 10 pounds overweight. Who do you think deserves to or should consider doing this? Should I do this for me?
Well, let me ask you a question. Do you think your cells would benefit by having more vitamin C inside?
Absolutely.
Okay, and that's what this does. So the answer is yes. The answer is yes.
But
Now,
would that cause me to release too much weight?
no, it shouldn't.
Okay.
Okay, this it it realigns to a normal situation. All right, and anyway, at the very low doses, it only really starts to pull fat off when there's a significant excess present. And well, for myself, I've lost about 20 pounds over the last 3 months, more or less, but it's just plateaued off now. I mean, now probably initially I might have been losing a couple pounds a week. Now I might be losing about a third of a pound a week. So I mean, it's just tapering off to the right level. And I would say this, not referring to you, but you look at a lot of older people, and we hate to be insulting and tell people who are slightly overweight that you're still overweight. Okay. But that's the case with most of the people. I would say 95% of the people is above the ideal weight. They have 1 pound, 5 pounds, 8 pounds around the belly, on the arms, just out of the other. So everybody, nearly everybody's got the excess fat, but it's not going to harm anybody that doesn't. And you track yourself too. I'm not going to discount individual variability. I mean, you do this, you be structured about measuring your weight and all. And if you find yourself losing weight beyond what you want, you either stop or you cut back to 3 times a week or twice a week, and then start getting the physiological effect of opening up the portals to get vitamin C in without hammering the what fat cells you do have to release their toxins.
Okay, contraindications. Anybody with a condition that's been a diagnosis, for example, fibromyalgia or, lupus or, ALS. I mean, is there any
Well,
contraindication?
they talk about histories of certain thyroid cancers and this, out of the other.
Mhm.
My gut opinion on that is it's probably not a contraindication, but I'm not going to go out and tell you to ignore a recommended
Yeah,
contraindication for these
yeah,
drugs. So
yeah.
go online, you'll see the list of conditions. There's not many of them where they say they don't even say you shouldn't take it. They just say, well, there's been reported possible problems with this, with taking this. So they're really not rigid, absolute contraindications. But like I said, I'm not going to tell somebody to do
No.
something that's against the official recommendation. But I will say, I really don't think those things are due to the drug when taken with the Super 8 supplements like we're talking about.
Yeah.
Now you're large, losing a lot of weight, just taking the drug, you still have your same crappy diet, you're not supplementing anything at all. Hey, I'm not trying to be flippant, but hey, anything can happen to you because you're releasing a flood of toxins into
Yes.
your body. You're not going to lose weight without releasing on a chronic basis a steady stream of toxins into your bloodstream.
Dr. Lee Cowden, he really has drilled this vision. I used to have this vision, but now I completely say Dr. Lee Cowden was the one that kind of drilled it in my brain. It's like etched in my skull here. And it's a tub. It's a tub. And he says, when you have a tub that is sealed and it has mud in it, and you add clean water to it, you get more mud and more toxins. You need to drain the tub in order for everything to start cleaning up. And then eventually the tub will become clear once you get rid of the mud. And so that's what you're saying. What you're saying is that as if people responsibly decide that they are going to do these GLP-1s, whether they're doing the shots, which is macro dosing, or the oral pill, which is a more of a lower dose, they need
And
to
they
be
have different oral
responsible.
doses, but I'm talking about low dose on the oral, yes.
Yes. And so, what would be the comparison, a shot versus, I mean, can you do a GLP-1 shot that's not just a peptide, because I know there's a lot of clinics out there doing peptide shots, and but they're still synthetic. They're not the natural body doing the whole process.
Well, I can't really address that. Yeah, you have a lot of clinics that are putting together their weight loss programs with all their everything they want in their own little soup. So I don't know, is that a benefit or no benefit at all? I will say this, I mean, they talk about this low dose on TV commercial, and when I looked at it, it was really nothing had to do with low dose until you tried everything that they wanted to try. And if after that, well, then talk to us and we'll see about getting you a prescription. So, I mean, at
Yeah,
least
you
that's
have to
how it seems.
read the fine print. Read the
Right.
fine print is what I'm hearing you say.
Or listen to the fine print in this case.
So if somebody has a condition like fibromyalgia, or they have diabetes, you've said clearly this is a great drug for people with diabetes. But if somebody doesn't have diabetes, and let's say they're an athlete, for example, and they are in really top tip shape, you're saying that they still can have a GLP-1 low dose orally without
Absolutely.
any worries
But
about their
definitely,
GI.
definitely with the diseases, because look at what we've talked about in the past.
Mhm.
Okay. I have found the Super 8 supplements. I haven't had anybody report back negatively. Quite the contrary, no matter what the condition is, they're blown away by what they're feeling. Well, what do those things do? The Super 8 ultimately works to put vitamin C inside the cell. Okay. So,
And increased magnesium, right?
yeah. And so I want to repeat to anybody who's listening about this one way or another is that I'm not suggesting this instead of supplementation. I'm suggesting
Correct. Good. I'm
absolutely
glad you said that.
supplementation is not an important, an essential part of it.
Yes.
The essential way to get the maximal benefit of opening up the window, the micro metabolic window of higher insulin, lower glucose level. That's what you want, and you want the maximal amount of stuff to come with it. And I just really see, again, except in these extraordinary circumstances, any downside at all. And
Good
the
to know.
the more disease you have, the merrier.
But if somebody starts doing this and they start experiencing side effects, you told them to stop, that
Oh
this
yeah, no,
may
I
not
mean,
be for them.
there's no way I can account for individual sensitivity. I mean, it's like an allergy or something like that. How can I predict somebody that's going to get an injection of penicillin that would otherwise
Yeah.
perhaps clear their infection to save their life, and instead they get a fatal reaction, or they just get a severe reaction? Okay, so yeah, no, I mean, listen to your body. Do understand though that when you take these drugs, it's quite normal to feel changes in your digestion. Of course, you start filling up easier. The satiety and fullness of the stomach is part of the effect on the brain. And that's probably an independent effect of this effect on the insulin and the glucose.
Mm-hmm.
And so, how prominent that is in you is an individual thing. So, if you, uh, sometimes people get a nausea and it passes. Sometimes people get a little diarrhea and it passes. And that just shows you also the variability. Some people get a little diarrhea. Some people get a little constipation. So, I mean, it just goes in whatever direction it goes. But that's an individual sensitivity. And absolutely, somebody needs to listen to their own body. But don't start it till you've been on the supplements for a while.
Yes. Okay. Now we're talking about dietary optimization while you're doing this, because you're saying that the GLP-1 is not the end all be all. It's what you do along with it. And so we've already talked about the vitamin C and the Super 8 supplementation. We talked about the toxins and stopping the toxins, because once you start releasing the weight, those toxins are going to inundate your blood system. And so you want to minimize that as well. But then what are we
You've
talking
heard the
about?
expression, you've heard the expression Herxheimer reaction, right?
Yes, yes.
This is a chronic Herxheimer reaction.
Got it. Got it. Okay. And then last but not I want to talk about fast foods. People that are taking these GLP-1s, they may continue eating the way that they were eating. What is the fast food model? when it comes to GLP-1, or what is the optimal nutrition? And I know that
Oh,
you've said in the past that that's not your forte, but let's
well,
talk
no, what
about
I'm
it.
going to say there is, I mean, optimal nutrition is optimal nutrition regardless of what else you're doing. So whether you're taking a GLP-1 and all these supplements has nothing to do with how healthy your diet is and how healthy you choose to make it. Okay. So, um, yeah, I mean, you have a lousy diet, you still have the downsides of that diet, or even more, the lack of the upsides of a good diet. So no,
Yeah,
I mean,
and definitely
so
nutritional deficiency. If you are
sure, sure,
eating,
sure.
absolutely. So even though you're taking these extra supplements, does not negate that you can eat the supplements, that you can eat the
Yeah, I'm not
nutritious way.
recommending this program as a reason to say, oh, well, now I'm just going to eat anything I want at any time and I'll automatically fill up when I'm supposed to fill up. And it doesn't matter how bad the food is because I'm putting vitamin C inside my cells. No.
No, mindset is important. Okay. And then the physical activity. How have you changed your life? Because I want you are our teacher today, and for more than one reason. Not only have you done the research, but you're also experiencing the low dose GLP-1. But have you changed the activity now that your body isn't hurting, now that you're probably having a better night's sleep because you're not coughing all night? So how has it changed your physical activity?
An excellent question because probably multiple reasons for this, but I was getting to the point where just a couple blocks of walking or something like that would get me short of breath. And I haven't done an echo. I don't know how well the heart's contracting, but now that's enormously improved. Number one, energy is very high. It was always a little crossover too because I had the back pain. And when the back pain, after a good chiropractic adjustment, I walk a whole lot better because my back's not bothering me. But something else too, since you asked, is and the older folks, for people who might be wondering, I'm 75. Okay, and guess what? Months ago,
I'm
I
wondering what you're about to say because we've had private conversations and I'm looking forward to hearing what you have to
okay,
say.
I would get up a minimum of 3 times and as much as 5 times a night to urinate. Now it's maybe once a night and sometimes not at all. Now, what is the physiology there? I don't know, but it's very dramatic and it's very real, and nothing else about my lifestyle or diet or supplementation has changed. Only that. Okay. So, again, I want to sound like I'm harping on something because I am. Everything in your body benefits when you get more vitamin C inside it, every single cell, whether it has to do with how responsive your prostate is or everything. Okay. If there's inflammation in the prostate, that's going to go down that you're not aware of. So I can speculate on a dozen different mechanisms, but the bottom line is without doing anything else different other than this regimen, all of a sudden I'm almost sleeping the night through, which is kind of unheard of after getting up as often as 5 times a night.
Well, that is amazing. And I'm sure a lot of women that have their husbands or their partners getting up 3 or 4 times a night, they would be grateful that their partner wouldn't have to do that either. So, do you find that more women than men or more men than women are opting to take this route to do
Oh,
the
I don't
GLP-1s?
have any information
You
one
don't
way
have
or
any
another.
information on that. I was just wondering if there was, when you were looking at your statistics, if men also found this as a benefit, the prostate
No, I mean, still,
enlargement.
most people are doing it, of course, primarily for overweight and for obesity. And that's pretty well distributed among both sexes. Perhaps women care about that a little bit. Perhaps a fat woman cares about it a little bit more than a fat man. I don't know. Just so I couldn't tell you, but I mean, I mean, like I said, we often just try to. We don't want to make people feel bad, but the over 90% of the population is overweight. Over 90%.
Yeah, yeah.
Not obese, but overweight. All right. I mean, you might be able to fit into a good pair of pants and look good and stand, but you can squeeze a little roll. You can squeeze a little bit. I mean, that's not the optimal body fat level. Okay. That's not to say it's bad for you, it's unhealthy. I'm just saying we need to recalibrate and readjust this idea of what is and isn't abnormal. So, can we live in a junk food society and we're always popping it down? And if you're not in a regular exercise program and you're not paying attention to different things in which you eat, you're never going to have a body like that. And that's okay. You don't have to have a body like that. But people need to understand that it's good for them, even if they're not massively obese, to bring down a few pounds.
So, okay, the GLP-1s, this is something that is being added, but it's naturally occurring in our body. By adding this to our body, would it keep our body from naturally producing what it needs to produce to manage the vitamin C and push it into the cell and do all that?
Well, I can't give you a definitive answer. I mean, they say, it's not like I'm in an office prescribing this all the time. They say that a fat person who loses a lot of weight and then gets off of it will often regain it. Okay. Now, that has a lot to do with a lot of discipline, how you change your diet, if you've had a little exercise. I don't think you're doomed to losing all the benefits the moment you stop. Okay. Again, so, but I can't tell you who that would apply to. That would be a separate type of individual type thing.
I just want us to, I'm looking at the long-term root cause, because I don't like to take medications. I would rather do something naturally first than do something that is synthetic. However, I understand that there are cases where, that it would help somebody start the process of detoxifying and get their body back.
But it's a good question. I have no evidence, and it's a valid question, of whether or not your natural levels or your ability to make naturally GLP-1 to stimulate the receptors, if that goes down with this over time. I don't know.
Well, you know what? That would be a great, I'm going to challenge you because you're the one that has it would be a nice thing. What can I do naturally to stimulate my own GLP-1s?
They have a number of things out there. I don't have the
Okay.
laundry list in my head. I think berberidine is one of them, but you go online and just type in natural products that stimulate GLP-1 receptors.
That's good. Hey, for people that would rather do it naturally,
Sure.
like this is an option to figure out what can we do
But don't
to
expect that
stimulate?
to have the same effect as the drug. But if you're somebody who's has very little extra weight, that would be something. Or if you have 15 or 20 pounds overweight, but you're not in any hurry to get rid of them, yeah, go ahead and go on that and see if over 6 months you're down 5 pounds. I mean,
Yeah.
again, don't look to lose a pound a week. I mean, we're talking about maybe, a tenth
Low,
of a pound a day
yes.
or
Because
less.
the
Okay. So,
faster you lose the weight like that, the more that skin that you will have excess
sure.
skin, and that
And
is
guess what else?
devastating.
What uses as much vitamin C as anything in the body? The skin. So if
Yes.
you're not supplementing the vitamin C and the other supplements, you've got none of the components to bring elasticity back into the skin.
So you haven't noticed the flabby belly after losing
No.
the belly weight.
No.
So final words, Dr. Levy. We're like the fastest class ever. What would you say to someone who would like to take back their life and feel that this is something that could benefit them as opposed to hurt them?
Well, the simple answer is the Super 8 supplements and getting a hold of a low dose semaglutide that we talked about.
Mm-hmm.
They have different brand names. Just go online and so you can. But if you use which I would recommend, the TrumpRx.gov website. All right, just type in the word semaglutide, SEMAGLUTIDE, which is the chemical name for the injectable for the Ozempic but it's oral form.
Very
all right.
good.
So, and then take it from there. And then I would, I wrote the book to cover all these issues. I would recommend getting a hold of the book.
That's right.
The Only Cause of Disease, which covers all these issues and explains why vitamin C is important as it is and what it takes to get vitamin C optimally balanced in your body. Because it's not until then that you'll ever achieve optimal health.
Well, Dr. Levy, I am so grateful to you for the research that you've done and for sharing it today in the classroom. And I hope that something that you said today or something that was said in the class today, that it will help others feel empowered to do their own research and make the right choice for them. So thank you so much for what you're doing.
My pleasure, Lily.
And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Thomas Levy, MD, JD, wishing you love, peace, joy, and unexpected abundance. Make it the best day ever.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.